What are the long-term effects of anesthesia? Imagine going in for a procedure and wondering if there might be effects lingering long after you wake up. While anesthesia is generally very safe when used correctly, understanding potential long-term effects is important for patient safety and informed decisions. One possible long-term effect is postoperative cognitive dysfunction. This condition involves memory problems, difficulty concentrating, and slowed mental processing that can last 4 weeks or even months after surgery. It is more common in older adults or those with pre-existing cognitive issues. Usually, these symptoms improve over time, but in some cases, they can persist longer. Another concern involves the heart and lungs. Prolonged anesthesia can sometimes affect heart rhythm or cause blood pressure to drop. For people with underlying heart or lung conditions, this might increase the risk of complications like irregular heartbeats or respiratory issues. These effects are often related to the length and complexity of the surgery. Blood clots are also a risk, especially during longer procedures. Blood clots can form in the legs, known as deep vein thrombosis, or travel to the lungs, causing a pulmonary embolism. Procedures like large volume liposuction or extensive abdominoplasty can increase this risk, especially if the patient remains immobile for a long time. Pulmonary embolism can be life-threatening, so doctors take steps to prevent it. During lengthy surgeries, body temperature can drop, leading to hypothermia. This can impair wound healing and raise infection risks. Pressure injuries from prolonged immobilization can also occur, especially in vulnerable populations like children or those with limited mobility. Other potential long-term effects include allergic reactions to anesthetic agents, aspiration pneumonia if airway reflexes are suppressed, and nausea or vomiting after surgery. These are more common with longer anesthesia times and are carefully managed by medical teams. In plastic surgery, surgeons aim to minimize anesthesia duration whenever possible. Combining procedures or planning surgeries to reduce time helps lower risks. Preoperative assessments help identify patients at higher risk, such as older adults, smokers, or those with heart or lung issues. Overall, anesthesia is a vital part of modern surgery and is very safe when administered with proper protocols. However, understanding the potential long-term effects helps ensure patient safety. Careful monitoring, personalized anesthesia plans, and adherence to safety guidelines all work together to reduce risks. If you're considering surgery, always discuss your health history thoroughly with your medical team to make the best choices for your safety and well-being.